There was just a break. Did you still hear me?
Yes.
Okay. So the goal was to reduce the number of children in out-of-home care by 50% by 2020. Interestingly, this is 2020. So a lot of ideas were considered, but the head at the time of the Department of Children and Families, our CEO of partnership at the time, and Casey Family Programs all landed on prevention as the answer and realized that we needed to move upstream and try to help families that deserve the help before abuse occurred in their homes. So a large community meeting as part of this process was held in Alachua County to both present the data and invite public input. And this is where it's so fascinating to me. The Alachua County Library Director at the time was attending the meeting. So he's listening and listening. And we shared the data that told us that we could help the most families in a particular zip code in Gainesville, where there were historically high rates of maltreatment. There were, and also poverty, domestic violence, crime, and education outcomes were also high. And then in addition to that, health disparities. So Medicaid births, preterm births, teen pregnancies, things like that. So at the end of this, the library director stood up and said they were about to open and build a new library in that exact area, because that was also a disparity in the area. Families didn't have access to free library services. And they also considered themselves a social service agency. And I think at the time, that was a really new idea for a lot of people. And he gave examples of how they really are a social service agency in many ways. And then he just simply said, how can we partner with you? So within the 30 days, we all decided we were going to open the library partnership, which is a full service library. You go in, and on one side you have your full service library, and on the other side, hopefully a few of you on the call may have visited us, on the other side you have our Family Resource Center. You can imagine that that's very non-stigmatizing. Someone can walk through the door and no one has to know what they're coming in for. They could be coming in to check out a book, to attend a program, or to really, come and meet with us for whatever they need, whether it's concrete needs, parenting classes, anything. And that's really it. So we also knew from the beginning we wanted to build on assets that already existed within the community and within the families. We were going to be strength-based in addition to place-based. And then Patty mentioned we've since grown 3 and soon to be 4 more centers. We've done that very slowly and deliberately. And now the beautiful thing is that in many instances, partners come to us. So for our second center, which was SWAG, the SWAG Family Resource Center, an advocacy group from that neighborhood came to us and asked if we would partner with them. We looked at the data. It was the next highest area of child maltreatment. And we said, absolutely, let's do it. And then for Chiefland, which was our first rural center, it was actually a church secretary. And that's what I mean. This can come from anyone and anywhere who came to us and said, we put a lot of our tithing aside to provide emergency assistance. It's getting overwhelming. So many people in our community need help. And I know what you're doing in Gainesville. Can we please partner? So those are just examples of different ways that you can end up doing this work.
Excellent. Thank you, Pebbles. And you mentioned this is one of your first presentations like this. Well, I wish I had that excuse. Unfortunately, I just clicked the final button to allow us to be able to be seen and heard by everyone. So I just want to pause here and briefly restate what I was saying about what a pleasure it is for us to have 2 ladies from Partnership for Strong Families. That's the CBC in circuits 3 and 8, join us today to talk about resource centers. And Patty, I hate to do this, but could I ask you to just recap one more time?
I do not mind doing that at all. Okay. So our resource centers, Partnership for Strong Families, operates 4 resource centers, as Pebbles said. So 3 are in Gainesville, one is in Chiefland, and then soon to be a 5th in Lake City, Florida. And the resource centers, they're open to the community. So families and individuals coming into the resource centers don't need to have any, previous or current involvement with the child welfare system. You or I could go in there today to receive access to some of these services and supports. And when they walk into those doors, they can receive services ranging from access to a clothing closet and food pantry, all the way to employability assistance and financial literacy programming or wide-scale community events. So while all of our services at our resource centers may look different based on the communities that they're serving, every service is tied to one of 5 protective factors. So our goal in doing that is to increase the presence of protective factors in our families and thereby reduce the likelihood that child abuse and neglect occurs. So we've seen great results with that. When you look at the data from the Department of Children and Families surrounding our 3 Gainesville resource centers, we've seen a decrease in rates of child maltreatment since those resource centers started. And so that data is really promising for us. And we have a really great opportunity that we'll get into in a little bit to further evaluate those resource centers as well. But it does show us, it's encouraging data showing us we're on the right track in what we're providing to our families.
Excellent.
Yeah, they're all, and so probably with what Pebbles was saying, I think that is probably a good enough recap. But I know we'll get into a lot of it as we proceed. Our resource centers, that last year they were seeing over 35,000 people visited our resource centers, and our staff and volunteers provided more than 46,000 unique services. So we're seeing that engagement grow. Of course, COVID-19, coronavirus, that's going to impact our numbers this year, but we never closed during the pandemic, and we can talk a little bit more about that too. But of course, that's going to impact everything that we're doing. So glad to be here today again, and thanks for having us, Chris. We're excited about this opportunity.
Thank you. Yes, and just for the people who were just able to join us, I just want to apologize for not clicking enough buttons soon enough. And thank you all for joining us. Thank you. If you've been on any of our previous webinars, Bringing Protective Factors to Life, this truly is, to me, one of the best ways to bring those protective factors to life, because this actually gets them on the ground in the places where we could call this place-based, right? That would be a good way to describe. So we just heard Pebbles talk a little about how they came into your area. Pebbles, can you talk a little bit more about what the elements of resource center model is that are helping keep children safe and helping keep families together? What works?
Sure. I would love to. So I'll kind of number these to make it maybe a little more understandable as I move from one to the other. And I do talk a little fast, and I hope that's okay. I know we have limited time. So I think first, and this was something that took us the first year of opening the library partnership to learn, that you must have a framework. And I'm sure for the majority of people on the call, everybody's like, of course you need to have a framework. But we started out so quickly and opened so quickly and just wanted to do good work. And, we kind of thought we knew what that community needed, and we just formed these partnerships and got going, and about 6 to 8 months in realized we need something to really guide our day-to-day decision making. So have a framework, something that keeps you focused on your mission, also be clear about your mission, and on track. And for us, Patty already mentioned that is the protective factors framework. It helps us decide if we are or are not going to provide, whether it's a particular service, to have a particular provider. It really is, it's just a beautiful framework to use for us. And I know there's been many trainings on that, so we are not going to go into any detail. There's people who are more experts than I am at this point, for sure. Number 2, I think it's important, your partners and the volunteers that you have. So a little bit more about that. One of the first steps, if you're starting this work, is to start recruiting and talking to potential partners. And they need to believe in what you're doing, and then also be willing to assist with whether it's free services or programs. Maybe they have connections to the community that you're serving that you do not have. Maybe they're going to be donors, or just give of their time. And I will mention then that all of our services, all of them are free to our patrons, and we have around 75 plus partners that we work with, and they're true partners. They're not just like one time done something nice, dropped off a donation. These are working partners. Along with that, I think volunteers. I think every presentation we do, it is important for us to remember to talk about our volunteers. I sometimes call them our lifeblood. I think especially if you can recruit and encourage volunteers that live in the community you're serving and who are reflective of those that you're serving is also important. They help build trust and bridge trust much more quickly than you may be able to do. They provide assistance in so many different ways. And we are very lucky and blessed to have the volunteer body that we have. And when you're staffing each center with 1 to 2 paid staff, which is the case in every one of our resource centers, but yet you're serving up to about 10,000 patrons a year, maybe at even one center, you realize that you just can't do the work without volunteers. So for us in 2019, we had about 80 volunteers, and they provided close to 12,000 volunteered hours, which equals around 3.5 full-time staff for that year. So kudos to volunteers. Last couple, location, which Chris, you already mentioned, but place-based, I strongly believe that location is extremely important. And I think you need to be where the people need it the most. And one center, if you open one center in your town, you can't serve every family. So it's important to be where you can assist the greatest number of families. You want to be accessible to those who may not have had historically equal access to help, and also may have historically been underserved. And this also, it removes transportation barriers, and most of our centers, it's within walking distance, right in what they consider their neighborhood. And then last, we can't not mention the importance of family and youth perspective to help identify what the community wants and also what they're ready for. We do that through daily relationship building and really focusing on a relational rather than a transactional approach. That's something that Casey Family Programs over the years, Paul DiLorenzo, has really helped us refine and be able to give a voice to why that's so important. We also do, of course, ongoing satisfaction surveys, but in those, they're very simple, but we ask, did you get what you came for? How are you treated when you walk through the door? And what else would you like to see? So it's a little different from some surveys. And then in all but one location, we have parent advisory councils, teen advisory councils, or formal boards. And we have learned to not dictate at all what those should look like and what it is they want to focus on. We let them also determine that. And then lastly, on that family and youth perspective, sometimes it's simple. Sometimes it's encouraging families to share their successes with us, to come back and tell us if they got a job or if their child made their first A on a report card, and to learn as staff to celebrate those small successes, I think is also very important.
Excellent. Excellent. Thank you, fellows.
Sure.
So one of the things, I got to go and visit a couple of times, and I think one of the things that struck me the most was the effort that y'all have put into reducing the stigma around asking for help or being willing to ask for help. So what I saw was really encouraging, that people were entering the building and actually seemed happy about coming in and being able to talk with the people there. Obviously, they had relationships, and you mentioned the word relationships. I think I've said this on about 1,000 occasions, but I heard somebody say several years ago, this work is really about 3 words: relationships, relationships, and relationships. So I can really appreciate that, and thank you for those details. Patty, can you tell us a little bit more about the grant that y'all received, and what does it mean to y'all?
I was on mute. Absolutely. So I mentioned before that we've seen some great success in the rates of maltreatment declining around our Gainesville resource centers, and that data is encouraging. But of course, so many factors go into that rate of decline. And thankfully, in Alachua County, child maltreatment rates are also on the decline. So we've been wanting for a long time to really do a more thorough evaluation on our resource centers, on the services that we provide, on how effective our partnerships are. And then, of course, we've always wanted to expand our resource centers. That's something that we look at as what community could be best served next. So the Children's Bureau put out an opportunity. This was actually, I will say, we applied for this 2 years in a row. The first year, we learned a lot and didn't get it the first year. But the second year, we kind of took back some of the notes and received a $2.7 million federal grant that's going to fund this project for the next 5 years. We're in year 1 now. And we're really excited about this. So yes, it was definitely a huge team effort, and one that we got about a day to celebrate, and then we had to start working on actually, putting the grant into motion. So the grant will first of all allow us to rigorously evaluate the services we provide at our Gainesville resource centers. So we're working with a fantastic evaluator. His name's Dr. Robin Perry. We've had the great fortune of working with him on a separate federally funded grant project as well. So he's helping us to evaluate the services we're providing. The next step will then be to refine the services that we are providing based on the findings of that evaluation. And then while that's happening, we're working to expand our resource center network into Lake City, Florida. So this is an area that for a long time we knew could benefit from a resource center, but it was really timing of the community being ready and us having the support to really kind of bring that model into Lake City. So we're working on that right now. Community buy-in and trust is extremely important to the process right now. We've established a Resource Center Advisory Council in Lake City, and these are members of the community, many of which are actually required by this federal grant to help us give voice to the community and make sure that the services we provide, while still tied to the protective factors, are truly reflective and responsive to the needs of the Lake City community, which looks very different than Gainesville and different than Chiefland. And we need to honor that. So the Resource Center Advisory Committee or Council meets monthly. We did go to virtual meetings. We had one in-person meeting recently, but I think we'll probably go back to virtual for the time being, it seems like. And they're an incredibly important part of our process right now. We've also been able to hire a new Lake City Resource Center manager. This individual is a longtime member of the Lake City community, and he also has experience serving on the board of one of our sister agencies, the Community-Based Care Agency in Jacksonville, Florida. So he has also the knowledge of the child welfare system and the needs that are here as well. So we're really excited about getting him on board and to build some of that community trust as we take this next step. The end goal of all of this too, as we get our evaluation findings back, is to really have kind of a nicely packaged framework for what really makes our resource centers work. And so that we can share that both locally on a statewide level and nationally to communities looking to replicate some of these efforts too, so that we can say, this is what, these are the unique elements that we found really do make an impact. So we're so excited and grateful for this chance to carry out this evaluation and expansion project.
Great information. I'm really looking forward to seeing what y'all wind up being able to do. I know you're doing good things. I know this is something that actually works on the ground, bringing the protective factors to life, so to speak. And I think this might be a good time just to pause for a second. And Nydia, do we have any questions for Pebbles and Patty?
Sure, we had a couple questions come in. I'll just remind everyone, if you do have any questions or comments, feel free to go ahead and use that question feature or also even the chat feature, and we'll take some of your questions. just a little while ago, we were talking about the family and youth perspective. We had a question on if you could elaborate a little bit more on the teen advocacy councils. And I'll let you answer that. I'll ask another one.
Sure. It's interesting because those, less so than our parent advisory councils, which remain pretty consistent, I will say that those have been very challenging. We've had some real success, but what we found works is they'll often come together around a goal, something that they want to do that may be short term. And so they'll have regular meetings always, as I'm sure everybody on the phone knows, important to provide snacks and make it a little upbeat, maybe some music. And they typically, they're not going to come in and commit, oh, sure, for the next year, I'll show up every Tuesday and, let you talk at me. Instead, if they've come to, say, our manager, Cherie, and they are griping about something in their neighborhood that's going on, or it could even be something, maybe a rule that the library has that they don't appreciate. And she'll put a group together, she'll get a core group of people, of kids, usually teenagers, and kind of empower them to come up with solutions. And we have also in the past been able to give them some limited resources, and then they have an opportunity to present their ideas, whether it's to our manager or library staff. That's one of my favorite examples is usually involving the co-location. Libraries have a history of being really quiet, and over time, sometimes that's caused a little bit of a problem. And the library has been really responsive to that feedback. And for instance, set aside after school what really is their kitchen and lounge and this large meeting room, and they've kind of turned it over to the teens can go right after school. They're pretty amped up. They've been sitting all day in class, not anymore, but historically, and they can go in there and they don't have to worry about being quiet. There's very few rules that they have to follow. There's snacks and drinks provided for them. Some work on homework, but a lot of times they're just socializing. And I'll be honest with you, if you're there between like 2 and 4, it's vibrating and it can sound pretty loud in there. And I know at first that made some patrons to the library a little uncomfortable, but altogether we had decided with their input that it was important for them to have that kind of safe place instead of maybe being on the streets or not being able to go home where anyone was at yet. And so that's one example. We don't have all the answers for teen groups. It's something that we actually reach out and even ask for ideas or where successes have occurred. But we have had some small successes like that have been very helpful. And I think sometimes teenagers do not always feel listened to or heard or see their ideas impact and result in a change. And so that's what I mean by, even if it's a small goal or gripe that they have, if you formalize that a bit for them and then have it result in some different rules, I think that leaves them feeling really empowered and teaches them to self-advocate as well.
Excellent. Thank you, Pebbles. Nydia, do we have any other questions?
Sure. You both, Pebbles and Patty, have mentioned some of the tangible services that are provided to families. Can you talk a little bit more about that and some of the barriers to service?
I can start.
Yeah.
One of the things you would imagine, so, and it's based on need. So at 2.5, I'll say, of our 4 resource centers, we have clothing closets. In those particular resource centers, that was identified as a need. There was not one located close by that people could access easily. We have another resource center where literally right down the road, there is a church that offers a beautiful clothing closet. And part of our model is that we don't need to be the experts on everything, and we don't need to do everything. The idea is to have a one-stop shop, and if somebody else is already doing it, then let's lift them up and help their program be more successful. So that's what we do. Even if we get donations there, we often send them down to the church. So clothing, same exact example applies to our food banks. We have in two of our locations, we have food closets. One is quite large in our swag neighborhood. That's considered as a desert. It's a food desert. There's no walkable grocery store. All there is a convenience store that honestly sells a lot of things that provide no health benefit and that cost more than they would at a grocery store. So we work really hard to have a fantastic both cold and freezer and non-perishable items. And in addition, we partner with several food banks, including Bread of the Mighty and others, who on a weekly basis bring in pallet after pallet of food. And again, I know some of you do this kind of work. And we've established rules so it's not chaotic and people can come and basically shop. And we try to make it like a nice shopping experience. And again, we do that where it's needed. So those are some of the main ones, but a couple that I mentioned that a lot of times, or at least I did not think of as a therapist, background, social work, child welfare. One of the things that ended up being really important at our centers is copying and faxing. For most of us, that's really easy to access. But what we found out is that people who are looking for jobs, who are getting name changes for a reason, maybe it's even things that are required legally for some past infractions that they've had, there's still a requirement to get things faxed or sent or scanned, and they may not have the $15 that say a bank would charge, et cetera. So that is another example of something that we've worked really hard to do. I actually have my administrative assistant. I had her get notary certified, and she travels around to the resource centers and provides that service. So that's another example. And then the last one that I think, again, we all know and has been, the need has just skyrocketed since COVID, is rental, utility, all of those types of assistance. Partnership has no budget for anything like that. So that is all grants that we have or donors who help us out. So whether it's United Way, we work with, there's all kinds of grants that's something that we rely on greatly, are grants. And we also refer to Catholic Charities, who actually is on the same block as one of our centers, and they do a lot of assistance as well. And that right now is one of our biggest focuses that I can mention later.
So a lot of focus on concrete resources, but also a lot of focus on connections. And again, yes. I think one of the cool things to me were the relationships that people had. It was obvious when people were coming in, they called each other by their first name. They knew each other, You could tell also that the folks in the swag community were pretty well versed on what was available on what day, who could help them with what they could get, what they needed to ask for. And that was just one of the more encouraging things to me. Patty, anything you want to add?
Yeah, I'll just say to build on that too, one of the things that I think is almost a barrier to getting the community to accept or understand what we wanted to do is we've heard feedback before, oh yeah, well, they just offer kind of handouts. So, when you're going to ask for more funds or something, there's this, I think there was, and I don't think there is anymore, but I think there was a misunderstanding about concrete supports and how important they are. And so speaking to that, the importance of our relationships, we can say that over 50% of our patrons coming into the resource centers do come in to access those concrete supports, which says that there's still a need for those as well. But what we're able to do through our relationships is to kind of talk to those patrons who are coming in, maybe a couple of weeks in a row to access the clothing closet. Our staff and volunteers can build that relationship and kind of work to understand what deeper level services that family or that individual might benefit from. So again, it's just, they're so important to be able to provide for our patrons, but a really important stepping stone to helping a patron understand kind of the full realm of what they can access at the resource centers too. But, you know, and it goes to, and Pebbles can talk way better about this than I can, but it really goes into Maslow's hierarchy too, of, you know, building upon each step and making sure that we're meeting those very basic needs first too.
Yeah. First things first, right? And I'll just add that I love that y'all have come up with a name for the people who visit, and that you call them patrons. I think a lot of us, and for a long time, I struggled with clients. You know, the word client. So I think that's a pretty good term. I mean, I think it makes them feel valued. It makes them feel like they're part of what's going on as well. So that's great. Thank you both. That's great information. And that actually leads me to one of the next questions that I wanted to ask. And I'm sure y'all get this question all the time as part of what we were talking about before we started today. What advice would y'all have for anyone who's wanting to do this, trying to do something similar? Some things to avoid, some things maybe you would do differently. What about that?
Yeah, I'm happy to talk about that a little bit. I'll start with things to perhaps think about avoiding. If they're on this list, it probably means that at some point we've made this as a mistake and have learned from that, which I think is really okay. We make them every day still. So to avoid, again, this is a lesson from Casey Family Programs to us. Avoid moving too fast. Start small with what you know, and that's okay. And I'll personally say that I've even had pushback in the past from my own bosses around that, because you know how CEOs, they'll get an email from somebody in the community who's a wonderful person who wants to do something good, right? Especially right now, you have a lot of people like, oh, I need to do good things. And they'll send him an email and he'll forward it to me and say, hey, can you maybe get this started at the resource center? And what we do is we go right back to our framework and our model and decide if it would even align with the work that we do and fit in. Then we have a conversation to see if they're a good fit, and we take it from there. So we've learned to very graciously say no, thank you, although we always want to start from a place of yes. So you don't have to do everything again. And then number two, avoid leaving out your community. I think we've gotten really good at this, but in child welfare, a lot of you know, we often have trigger reactions, and for good reason. A lot of times it's as a result of a tragedy. But as a result, you forge ahead without building the plan with the community. And I would just say don't do that in this case. I think it's going to be hard to be successful if you do. Take the time to go door to door, have focus groups, form an advisory council of the right people, and that even takes a while. And then listen, sounds simple, but really listen to what they say while putting aside what you think they need. I think that would be good. And then last, to avoid mission drift. Again, seems so common sense, but easy to do. You'll get pressure over time as you're doing a good job to do other things. Can you get every 3-year-old ready, kindergarten ready? Can you please take care of that? Can you please, we have a domestic violence problem. Can you please solve that? And although all of our work over time, we strongly believe will impact those things, none of those are a quick fix. And our primary mission is to strengthen families, build on their assets so that the verified maltreatment is decreased. So avoid mission drift. And again, you're going to have wonderful people and organizations who want to be a part of your resource center. But if it's not a part of your mission or doesn't fit within your framework, learn how to very politely say no. And then the other side, lessons learned. We've mentioned this, so I'll be quick on it. Build and maintain your relationships. So you can't just build them in the beginning and then assume that that partner is going to stay on board for the next now 11 years we've been doing this work. So you establish that partner or that donor relationship, but then you work hard at it, just like you would any relationship you have. whether that's your marriage, a friendship, anything. It's really the same thing. And then number two, work on sustainability from day one. This could actually be a whole workshop in itself, but I'll just say, you're recruiting partners who can do their work and be the experts that they are without charging you. And they really will agree to do that. And then who will be there for the long haul. You learn to diversify your funding through grants and donors and in-kind. In-kind has been really critical to the work we do as well. And then last, I would say we've learned to hire the right staff. The staff need to be flexible. They need to be able to handle stress well. There's a lot of unknowns day to day. They need to have a positive attitude. And then last, that they should be knowledgeable about their community that they're serving. Ideally, they're from that community and reflective of the families that they're serving as well.
Excellent. Patty, anything to add?
I'll add real quick from my side because, I get to kind of work on communications for the resource centers as well as our agency. And just real quick to say, it's so incredibly important to be very aware and respectful of the experience of our patrons. So I think it's really easy, we'll have media attention. We'll have, CBS call and want to do a story on, the great work that we're doing at our resource centers. And can I come and film your patrons? I know you have this food giveaway coming up. We're really protective of that. And I have to have some hard conversations sometimes to say no. I think it's important that we do that because if we have a culture where we prioritize the community looking in on the resource centers rather than the patrons' experience at the resource centers, it's not going to be a non-stigmatizing, welcoming environment for people to access these resources. So as we explain that to the media or to our partners who want to take pictures and post on social media, stuff like that, people tend to be very understanding of it once you do explain it to them. But we've had to have some difficult conversations, and I think it's important. We don't go out and say that this is really like in a public forum to say this is a child abuse prevention program. This is a family strengthening program. So I think, and just like you said, we call our people who access our resource centers patrons. Language is so important. So I think that's another we've had to learn that lesson and build upon it as well.
All right. Well, this would probably be a good time for me to mention again that there are handouts that are included on the right-hand side of your screen. If you click on the arrow that says handouts, those are 3 documents that will help you learn a lot more about the resource center concept, about the particular experience in the Gainesville area. And I'm really glad as a young man who grew up in a rural, very rural setting, area, that y'all are reaching out and branching out into Lake City, even though Lake City's got to be pretty big now, being right off I-75. So, Nydia, are there any questions that would fit at this point in our conversation?
I will wait, but I just want to add that if you did submit a question, thank you so much for your questions. If we haven't answered it just yet, it's probably because it matches more closely with another segment. So just in the interest of time, just kind of stay tuned and we'll get to your question. Thank you.
Thank you, Nydia. So one of the last questions that I have for y'all would be, how are you adapting? And I think one of the questions that I saw relates to this, but how are y'all adapting your work to respond to our current situation, especially concrete and emotional needs of your patrons, given everything that's going on?
Chris, I really like that question, even though there is not an easy answer. So I'll start by saying we're doing the very best we can, and we're doing it with really good intention and trying to be thoughtful about it, because the way you word the question, concrete and emotional, I think really gets at it, that it's just not one or the other, especially when you consider we don't have just a pandemic going on, which every time I say the word, I feel like I'm watching some movie. We also have what everybody is aware of with the heightened awareness of the racial injustices that have always been there, and that are even more present right now for all of us to see and feel. So I guess I would say, as far as the impact of both, really, I often visualize Maslow's hierarchy. So it's impossible to worry about higher level needs if you do not even have safety and security. And a lot of times when we share Maslow's hierarchy and that idea, when we're talking about resource centers, I'll be honest, in the past, and this is something that we really missed, I think, it would be, if you don't have food for your children, then how are you going to really worry about nurturing and attachment and all these other things? But you know, when I look back at that triangle of the hierarchy, it is about safety and security. And security may be a roof over your head and food for your children, but safety is, I think, what a lot of people are experiencing now, especially people of color, you know, that they don't feel safe sending their children out to go run an errand. And so I think for us, it's really reminded us of how that is going to impact families, has, and is going to continue. So I think that's just important to think about. And so as we're making our decisions about how to help, we're doing that. So we're trying to listen. Again, I've mentioned listening, but we're trying to listen to our patrons even more deeply, and offer some sense of safety or security, and allow them to just talk about what's going on. A lot of anger that we're seeing, understandably, but we don't have a quick fix for the problem, but we at least want to be there to listen to them. And then for the pandemic and the impact of that, that's a more simple thing, right? So we're trying to assist with concrete needs, again, by partnering with food banks, local restaurants. Our restaurants have really stepped up to the plate, especially local, as opposed to chain, interestingly. And then also the school board. So we've partnered with all of them to not only feed children, but their caregivers as well. Because what we found really early on, the school stepped up in Alachua County. They were feeding children every single day and giving them 2 meals. But we have a lot of parents and caregivers who are also hungry, if they had already lost their jobs. So we also tapped quickly into local grant opportunities here in Gainesville from United Way, the local community foundation, which is a philanthropic organization that did fundraising to raise money for emergency relief for utilities and rent. And we were able to get some of those grants and have been put a system in place very, very quickly to make sure that we're serving the right patrons with those needs, and then doing that. And then we're talking with our partners, all of the 75 partners I've mentioned, about what it is that they're doing and what they can provide. And we're doing a lot of cross-referring on a daily basis. So if Catholic Charities still has a pot of money for rental assistance, then we're going to send our patrons there, but we can help them out with something else. Since the crisis initiated in March, the resource centers have provided nearly 10,000 services and supports, and you know, understand that that means, you know, meals provided and things like that, but a huge number, and that's included food, clothing, and financial assistance. There's still a lot of unmet need here, and I think we're only just beginning to see it. But again, we're just trying to do our best.
Yeah, yeah. Well, I just want to say that you mentioned that listening word 3 or 4 times already, and people may have heard this, but I've heard it said that we got 2 ears and 1 mouth for a reason, because we're supposed to listen twice as much as we talk, and I stand guilty of that myself way too often. So I'm really glad to hear you stressing that, Pebbles, and And I think really you've said that throughout this entire presentation. What y'all have done really is to begin the process by listening to what the people from the community were telling you that they needed. So I just want to commend y'all and thank you for saying that. I think that's worth a whole lot, is not to just go out and plant something in the ground because someone somewhere, and you mentioned those emails or phone calls that we've all gotten from time to time because a certain person in a certain situation or position has said, I want to do this or I want to do that. Well, that may very well be well intentioned and a good thing to do, but first things first. And I think listening obviously has put y'all into a good situation where you're able to tailor your programming according to what each individual community needs. And I just want to give you a chance, Patty, to add anything to that you'd like to add.
I think Pebbles really said it perfectly, and I'll kind of echo what she said earlier about something else, but hire the right staff. I've been in awe because I've been kind of a little bit more on the outside looking in as the resource centers continue to function. But we lost a lot of volunteer support because students had to leave, obviously, when the pandemic started. I've had staff members who have volunteered to go and serve at the resource centers to keep them operating. Our managers and our staff members at the resource centers are there day in and day out. And personally, this pandemic has affected everybody. And, you know, it has never been easy or not scary to not leave your house right now. And they are continuing to do it because we understand and they understand that people need the resource centers now more than ever. So I'll just echo that it's hiring the right staff who truly believe in the mission. I've been in awe watching that. So
yeah, I think we can never say enough about that specific aspect of the people who do this kind of work, Patty, and thank goodness, you know. I'm also really glad to see that there's some attention being paid to that. We talk about not being able to give from an empty cup, and we talk about compassion fatigue and vicarious trauma and folks who are in those circumstances in the centers and you know, having to hear these stories over and over and over again. I know again Jerry Milner talks about the workforce and how important it is and how we need to make sure that we're caring for our workforce. And I've heard that from other places too. So I just want to echo what you're saying about how appreciative we are for the folks that are out there in the field. A lot of them on this call,
Yeah.
a lot of them that are watching and listening today. Thank you all for the work that you're doing, because there's God knows there's a plenty of need out there. And I just want to thank y'all and them for what you're doing to help people, and especially to focus on the factors and the protective factors and what they can help us, you know, kind of point toward, like a North Star or guiding star, so to speak, to say, hey, you know, we've done some research. We know the science tells us that if we have these things in place, whether those are essentials for childhood or social determinants of health or whatever they are, we're talking about the same thing, and that is meeting people where they are, but also bringing stuff with you to help them, not just going empty-handed to meet them, but meeting them with the things that they need, whether that's emotional, psychological, physical, concrete need, whatever that is. I just want everybody to know how much we appreciate what they're doing, and certainly what y'all are doing too. Nydia, did we have a couple of other questions?
We do. Let me take just a second, and I got a little notice of a bit of issue with audio. So if you can hear everything okay, hopefully you're hearing us clear. There was just a little bit of fading with the audio, but if we're good to go, let me know a little something in the chat box if you all are hearing everything okay. Pebbles and Patty did mention some of the services at this unique time dealing with the COVID-19 pandemic. We did have a question come in. Let me pull it up. I know that things are ever changing in terms of policies and recommendations, and we're kind of navigating as we go. We did have a question about, is there any data, if you could share any data on the rise in child abuse in Florida since COVID-19? That question came from Kristen and Julie from the Golisano Children's Hospital of Southwest Florida. Thank you for that question.
I don't believe that we would have the data yet because things really are still locked down. I think everyone in child welfare is very nervous, right? Chris and Nydia and probably everybody else, because I think we can make a pretty good guess that we're going to see a spike when children become more visible. I know Patty may have something to add to this because I believe we were even contacted by a reporter to give it some information, but as far as the data, we just don't have it yet. What I will mention though, in our area, shelters are still, hopefully y'all can still hear me, I just got a little buzz, but shelters are still quite high. And what it looks like is happening is that the cases that are coming in are unfortunately pretty serious because we have learned not to shelter unless it's absolutely necessary and a child can't be saved with services and supports wrapped around. But I even late last night, sadly, received notice of 3 shelters, one with 5 kids. And it's just devastating. Because a lot of work is done to try to keep them together. I think substance abuse, we're going to see a real uptick in that, as well as domestic violence. And we're all bracing ourselves for that, knowing that it might be eventual, sadly. Patty?
Yeah.
Come in. I have a couple of things to say as well.
Yeah. So for our local data, I'll say, we get reports, I think every week or every other week about calls coming into the hotline, and they have decreased steadily since everything started. So we do know that it's unfortunately most likely not because child abuse or maltreatment has stopped. It's just that reporting. In our area, over half of our reports tend to come from teachers. So this is a drop that we kind of expected to happen as schools shut down. We always look at what we can do now, and one is awareness and education. And so Pebbles is right. We had a reporter reach out, and we tried to let the community know how to recognize and report signs of maltreatment, and that it's okay to make that call, and that really you're getting a family access to those services and supports that they need by making a call, and protecting the child ultimately. The other thing that we've been doing is trying to mitigate some of the kind of stress levels in families at our resource centers. So some of the concrete supports that we've been giving out now are, and Pebbles and I just got pictures of this, but for families like a movie night, and we gave a red box gift card and popcorn and some candy and I think a game, things that families can do together where, they might not have the ability to go out and purchase those items on their own, or, really have the idea of a movie night even, and when it's kind of put into your lap like that, it can really be helpful and recenter the family. So we're trying to do things to kind of build in some support, some fun, for lack of a better word, during this time for our families, and we're trying to concentrate on that a little bit.
Yeah, it's hard. I know people are looking all over the place trying to figure out what can we do during this time that's safe. What can we do with our families, because we all need a break. A lot of people have been home with their kids a whole lot more than they're used to being, and I think we're developing a whole new appreciation of teachers and childcare providers and the hard work that they do, and not to say that it's not rewarding and that they don't enjoy it, but also not to say that it's something easy that just anybody can do. So I want to respond specifically to that question though, Nydia, because in fact what we've seen is as abuse rates have gone down during this time, and we do believe, most experts share this opinion, that it is a lot to do with kids not being seen as much, and and I believe statewide, and someone can correct me and type in if I'm wrong, but I think statewide it's about a third of reports that come from school personnel. So it was to be expected. However, I did see a couple of articles over the past couple of days that said child welfare experts see no evidence of increase in child abuse and neglect during this time of pandemic. And my thought, and not just mine, but a lot of people who have responded to those articles have said something very similar to what you've said. And in the early part of my career, I was fortunate to be able to work at the abuse hotline. Unfortunate in that there was a whole lot of vicarious trauma that goes into listening to those calls for 8-9 hours a day. But I can tell you, based on my experience and what I can glean from all the information that is available, it's not that we don't think that it's going on. It seems to me that it's more that we're not being made aware of it as much. And it is my concern, and I know a lot of other people share this as well, that we're going to be seeing a big bump, if you will, or an increase in the number of reports once kids start being seen on a regular basis by mandated reporters. I want to give a shout out to DCF, to the Department of Children and Families, and other partner agencies as well, who did get together and send out. And if anybody's interested in this, I can email them to you. But those 3 sheets on reporting, how to recognize the signs, but more particularly, I think what we're seeing now is people, doctors, teachers, people who would ordinarily, case managers certainly, ordinarily going into the home, are not able to get that full-blown view, if you will, physically of the child, or to be able to do an accurate assessment just based on what they can see through the video screen. So I'm worried about that. I think a lot of us share that concern. But as far as right now, as it relates to the question, we have not seen an increase in the number of abuse and neglect reports during this time. Anybody have anything else to add?
No.
Nidhi, you want to do one more? Or do you have
we had a couple questions. Yeah, we had a couple questions come in. People curious about how you recruit some of your volunteers, as well as those teams on the advocacy group. How do you recruit them? How do you train them? And then another question that we had from Maria Long regarding any community cafes. Can you speak to that?
I can speak. Okay, so volunteer recruitment, several different ways. We actually have it listed on our website under our career opportunities. We have volunteers listed for people that just may be looking that way. In addition, in terms of making sure that we have volunteers from our community, we usually recruit from patrons when we can. So it may be someone that has come in because they're in a crisis, or they need, just like every one of us, 100% of us have needed help at points in our life. So maybe they came in and we get to know them a little bit. And it may even be that they have an opinion like, you know, that clothing closet would work out a lot better if you set it up this way. And that's a great opening to say, would you want to come in once a week and help out with that clothing closet? So we end up sometimes with volunteers that are community members. We've even hired staff as 12 to 20 hours a week through, there's 2 older women, I want to say their names, but I know you won't know them, but for me, they're like family at this point. And they started as patrons, and then we were able to partner with, it's I'm not going to remember that. It's like a CSEP. There's one that's aging and Black women that are trying to re-enter the workforce, and we have a MOU with them. And then we actually were able to say, we have this wonderful woman who's been volunteering, but she could use income. Could she become part of your program? And then she's able to work for us and get paid, but they're paying her because honestly, we don't have the budget to do that. So those are some of the examples. And then our interns come primarily from the University of Florida or Santa Fe College. We go and speak to specific, and Patty has been involved in this quite a bit in the past, specific programs, whether it's family, youth, and community sciences. There's several, actually public health. We have fantastic interns from that program as well. And we speak to their class. A lot of them are looking for either volunteer or actual formal internship opportunities. And we have a lot of them that way. I think they find the experience very meaningful and they learn a lot. So we have a good kind of steady stream coming in. And in terms of how we train them, much like we would a staff member, that is actually a big lesson learned. We didn't start out that way. It wasn't as formalized. And over the years, we've developed kind of an onboarding process where we introduce them to our model, our framework, and set very clear expectations about customer service. We haven't talked, that's again, could be a whole nother training, but customer service and what we expect in terms of respecting every person that walks through the door, even if that person is unable at that moment to treat you with respect, we still expect it. We've probably lost a couple interns as a result, and that's okay, but not very many. Usually they're actually fantastic. And in terms of the teens, I'll just mention very quickly, for those groups, it is most definitely teens who are participating either at, say, the library, in their activities or at the center with some of our activities. And then we strong arm them in many cases to become a member of any short-term teen advisory groups that we're putting together.
And listening again, I think is another, this is another time when you do that. And Patty or Pebbles, I want to give y'all a chance to comment on Maria's question. But let me just say it was my fault that I didn't click start broadcast in time so that people didn't get to hear your eloquent presentation about what all services are associated. Each one is different though. And I don't remember if y'all have, I was going to mention that support groups certainly are one of the services that can be associated with a resource center, family resource center. They're called different things in different parts of the country, but I don't know if y'all have any support groups that are affiliated with your resource centers.
We don't. That would be great. We've tried mom groups in the past, mom support groups for us. And that's one of those things we thought this is going to be so great. These moms, they need to be able to come in. They can bring the babies. We even built out in the library side this little, we called it the cuddle corner. And it didn't take off. And so I think it's always important to say that. It's just not what the community has asked for. Things evolve over time. We used to not get a lot of asks for parent education, and we've seen that increase, probably maybe because there's more stress with having your kids home all the time. And those often do look like support groups, Chris. So we're not just talking at people. We've even done a group in the past where a graduate actually facilitated and helped lead that parenting type group, which you could probably define more as supportive, but not a lot of other support groups, I would say. No.
Yeah, as you said, each one of them is different, and it's really it's hard. I know a lot of folks have gone virtual with their meetings. We do Circle of Parents out of our office, and Nydia does a great job with training. It's really been a challenge for people to maintain their participation. So some groups have gone virtual, obviously. I just want people to get the support that they need, and I know y'all do as well. So, Patty, one last shot. Anything else that you'd like to add?
No, not about that. We've seen the support groups. We've, through Casey, had the opportunity to see them at different areas. Pebbles and I traveled to New York last year and saw a great example of how effective they can be. And so again, it just kind of goes back to the community, and what the community is really asking for and needing. In this resource center in New York, it was their parent cafes. It was just set up so perfectly. It made me want to participate in the parent cafe there. It was really cute. They made it a real home environment where there was music when you walked into the resource center, kind of like relaxing spa music just to set a tone. So I think it's neat and important to say that from resource center to resource center in different communities, it will just always look a lot different. So we've seen some great examples of that, but like Pebble said, it hasn't taken off here. But
Well, again, I just want to say how much we appreciate y'all being on today. How much we appreciate the people who are out there listening and watching us and asking questions. Again, thank y'all all so much. I just want to offer a little bit in the way of closing. And of course, I want to say thank you to Pebbles and Patty and Nydia for helping with the questions as well. But I want to, I'll read or paraphrase a little bit from Dr. Milner's letter that I referenced at the beginning. And if you didn't hear me, this is certainly one of the things that we know works. We have evidence for resource centers. And I'll just read you or paraphrase a little bit about what he said in the letter as it relates to prevention, especially primary prevention. He said, imagine with me for a moment what the world would look like if public health systems' major strategy to combat a serious disease like polio was to invest in wheelchairs and crutches for patients after they fell ill instead of investing in vaccines to prevent illness, or if car manufacturers invested in jaws of life and ambulances to get victims out of mangled cars in the hospitals faster. And that was their primary way that they wanted to address those injuries and accidents. And so instead of developing safety belts, airbags, warning systems, and other safety features to prevent injuries and accidents. And what if the way that we dealt with baseball or football or sports injury was to buy more ice packs or neck braces or slings or whatever, as opposed to asking players to wear protective helmets, shoulder pads, and other protective gear. So unfortunately, that's the way that we've traditionally operated in our country when it comes to keeping children safe and protected, not just physically, but emotionally as well. We've invested all our money in placing children in homes rather than their own, and trying to do therapy to fix the trauma after they've been abused, neglected, or abandoned, instead of investing in helping their parents to care for them safely before they're abused and neglected. So what would it look like if that was the system? Well, it would look like it is now. If we invest in after the fact, we got 437,000 children in foster care. That's a 10% increase in the past 5 years. 4 million reports of child abuse every year, because that's the case. That's what we do now. To me, if we have any serious hope of stemming this increasing demand for foster care, we have to commit ourselves to strengthening families' capacity to care for their own children, and committing to recruiting more and more foster homes is not the answer. What we need to be able to do is to break that intergenerational cycle of trauma and maltreatment and put our money and our efforts further upstream or up the river before families fall over the waterfall. So thank you both, and thank you everyone for tuning in. I do believe that we can make progress. Go ahead, Nydia.
Chris, I'm sorry. I wanted to make sure. We just had a quick comment from Kathy over at Florida Braille and Talking Books Library. She says that this participatory process of community engagement and education is such a productive and effective model. So she just wants to say thanks for sharing. And I also, before we close, want to remind you, Chris, if you can remind the participants how they can get access to this recording, as well as our presenters' contact information.
Yes, absolutely. You can email me for any questions that you have at clolley, Lolley, @ounce.org. And this webinar was recorded and will be available on our website. We have an entire page devoted to these Bringing Protective Factors to Life webinars now, and that's at preventchildabusefl.org. So thank you to everyone. Pebbles, yes.
I was going to add one thing. Please also feel free to go to our website. It's PFSF, which is partnershipforstrongfamilies.org, and it should be /resource centers. And there's a lot of information there about the resource centers, including like a 10-minute video that Casey Family Programs came down and took about a week to produce for us, that I think gives a perfect overview of what we do. And you're welcome to look at that and then contact us if you have any other questions.
Well, thank you both again. We appreciate y'all very much. You know that. Thank y'all for joining us today. Thank you, everyone, for joining us and what y'all do. Have a good day. All right. Bye-bye.